Hi, my name's John Gannon. I'm a public health doctor from Ireland, and I'm the chair of the Tobacco Control Working Group of the WFPHA. My background is mostly in child health, and I've been working in pediatrics in various children's hospitals in Ireland and also Australia over the last few years. And now I'm working full time in public health as of this year. I also spent some time as a public health volunteer in Zambia in 2022. So global health is something that's really interesting to me as well. And my current role is a specialist registrar in public health in the Health Service Executive, which is the Irish Health Service, and I'm based in Dublin at the moment. So when I studied medicine in university, I was always really fascinated by the health system, health economics, interventions that were done on a population scale and how it all fits together. And I always found that a lot more interesting and suited to my skills than individual patient interactions and treatment and diagnosis. So I was always curious about it as a career. And I also felt like doing public health really well could have a far greater impact than working with one patient at a time. So I looked into it and I enrolled in a course in the UK, a diploma in tropical medicine and hygiene. And doing that really reinforced my interest and my desire to really get involved and become a public health physician as my full-time job. I also had an interest in smoking cessation from quite an early stage. So while I was in university in my final year, I wrote a book which is called Time to Quit Smoking, a 100-day guide to saving your life. That book's on Amazon, and it's a guide to help smokers to get through the first 100 days after quitting, which is, of course, the hardest part. So I started to do things like that and get involved in public health research and different courses. And now I'm really excited to finally be a full-time public health doctor. And I chose to, the structure in Ireland is such that you have to do a certain number of clinical years before you can do public health. So I chose to do pediatrics because I really enjoyed it. And also I feel like there's a lot of overlap there between child health and public health and a lot of great work that can be done with the two. So I first came in contact with WFPHA in 2020 and I applied for an internship. So the Federation runs these fantastic internship programs, which are usually 3 months in duration, to give it a bit of a taste of what it's like. So I was very delighted to be selected for that position, and I started in January 2021 on an internship basis. It was meant to be in person in Geneva, but due to COVID restrictions, I ended up doing it remotely from Ireland. Um, it was a really fascinating time in public health because it was the middle of the pandemic and also the vaccines had just been approved uh, really recently, the first vaccines to come through against COVID. So I was really excited to be involved in public health in this way during that time. I joined the Federation's International Immunization Policy Task Force. I've always been a bit obsessed with vaccines and very passionate about them. So now that they were finally the main headline news everywhere all the time, you can imagine my excitement. So as my main project for my internship, I researched how different countries were approaching the rollout. So I looked at countries from around the world like Australia, Ireland, UK, US, Nigeria, Indonesia, India, and I analyzed how they were taking this challenge on and what different steps they were taking in terms of logistics and getting everyone vaccinated. I wrote about that, and then I published those blogs as a paper eventually. And just as my internship was kind of coming to an end, there was a vacancy in the Tobacco Control Working Group leadership role as chair. So I applied for that role, and I was selected for that position. So that was about 3 years ago, and I've been the chair of the Tobacco Control Group since then. So really enjoyed staying connected with the federation. So the Tobacco Control Working Group, we usually have around 15 members at any given time, and people do drift in and out of the group according to availability. So, it's reasonably fluid in that way, which I quite like. There's no real commitment obligation. People can come in and out as they have time. Although we do have a core membership of some members who are always there, and we've really good international representation as well. So we have members from Serbia and Germany and Australia and parts of Africa as well, and the States and Canada, and a lot of India and Bangladesh and stuff. So it's a great team. And we work really at research, education, advocacy, increasing public knowledge, promoting public health through the lens of tobacco control is what we do. So when I first took over in 21, for the first kind of 18 months, maybe a couple of years, that our main goal, our main objective was we were researching and writing all about tobacco industry tactics. So we were looking at what does the industry do to undermine tobacco control policy, to influence policymakers, to manipulate consumers, really just to push their deadly product as much as possible. So we generated this casebook with 7 key tactics about what the industry does. And we, with help from the World Federation, we widely disseminated that, and it proved to be very popular. And we were invited to present our findings at the World Congress on Public Health in Rome, which was in 2023. And then I published a published paper as well out of it subsequently. So that was a lot of what we did in the first kind of couple of years. And then more currently, we're doing a research project looking at surveying young adults' opinions and attitudes towards tobacco endgame. So moving past tobacco control into endgame, and also their opinions about e-cigarettes, which is a relatively newer threat, and looking at what kind of policies or restrictions might be preferable or might be suitable to mitigate the harm from e-cigarettes, as well as continuing on the great work that's been done to reduce harms from tobacco products. So that's our main work at the moment. We've done the survey. We have about 300 responses, and we're going through the analysis and that. We've also recently started collaborating with another group, the non-communicable diseases group, and they're looking at developing an anti-tobacco campaign. It's in Nepal based at the moment, and once it kind of gets up and running and approved, the idea is to spread it more internationally as well. So that's another exciting project. So and then I suppose another thing we've kind of done every year is participated in Global Public Health Week, which is a great week that the WFPHA organizes every April. And for the last 3 years, we've either held webinars or interviews or various events as well as to represent our group during that week as well. So the WFPHA published a strategic plan for 2023 to 2027. And there are 7 goals in it, which cover the objectives of the Federation going forward. And goal number 4 is to develop and advance public health knowledge, education, practice, and research. And this is the goal that fits most in line with what we do, whether it's generating evidence, whether primary or secondary evidence, presentations in international conferences, publications I've already mentioned, things like the casebook, the survey, the webinars, really increasing knowledge about tobacco control, both the opportunities and also the threats that are there, and increasing awareness among public health professionals and also members of the public. That's kind of the main goal that fits with what we do. Another goal that's number 5 is to grow new and strengthen existing partnerships with groups or individuals who share our values. So the World Federation has, I think, 135 member countries, and it's increasing every year. And what we're very keen to build our relationships through our group. And one example is the current project with the tobacco endgame study. A similar study was done in an Irish context in 2022, and I met with the Tobacco Free Ireland team who carried out that project, and I asked them for advice, and they kindly offered to guide me and let me work off of their survey as a starting point for our global survey. And subsequently we now have a strong connection when one of the Tobacco Free Ireland team, for example, joined the group, and we continue to build relationships like that. So it's really a great opportunity to kind of network and increase the reach of the World Federation as well. The network is so powerful. There's a really good international mix of people there with different skill sets, experts from around the world that you can call on. Our group is very grateful for that. For example, when we're trying to spread knowledge, or for example, the survey we're working on at the moment, we were able to tap into the WFPHA's contacts and networks to spread it far and wide, either on social media or through other working groups. And that's really helpful. Or if we need someone with certain skill set, And it's been really helpful getting those contacts through the Federation. We also have had quite a lot of opportunities to collaborate with other working groups on projects. So I mentioned, for example, the current one where we're working with the non-communicable disease team on their anti-tobacco campaign in Nepal. Previously, also, we worked alongside the oral health working group for a review of tobacco cessation strategies in pregnancy. And this is something that has been working on for quite a while. And we held a webinar on this and also presented it at the World Congress in Rome last year. And the Oral Health are leading this one, but they've done really great work, and we've been happy to help with them in terms of getting a really good developing frameworks for kind of tobacco cessation strategies in global context. We've also worked with the Environmental Working Group on a scoping review of the environmental impact of e-cigarettes. And we published that last year in the Tobacco Prevention and Cessation Journal. And then also the Young WFPHA, the Young Professionals Group, and the Women, Adolescent and Children's Group. We worked with them on this current project in terms of the young adults and the opinions on endgame and vapes. So really, the WFPHA creates this environment where the working group chairs and members kind of know each other and can call on each other when there's overlapping teams, because there's about, I'm not sure, 12 or 13 working groups, but sometimes things overlap. And it's really helpful to have those other experts there to call on. And it's been, in my 3 years with the Federation, I've had really great support from the team, from the likes of Bettina and Marta, Maria, Razier, Aranska, and now you're Martinique yourself. It's always very easy to get input and direction and guidance and sort logistical things out or spread messages and things. So it's a really constructive environment to be part of. So the Framework Convention on Tobacco Control it's a global treaty that came into force in 2005. And it's actually the first treaty to be agreed by the WHO. And it's been signed by around 180 countries. So nearly every country in the world has signed this. And it's a series of standards that governments need to implement to restrict harms from tobacco, whether as primary users or secondhand smoke. And it's been very successful in what it set out to do to reduce the consumption of tobacco and also the harms from it. One example of an article in there is Article 5.3, which is one of the kind of more famous articles in the framework. And it stipulates that the tobacco control policies must be protected from commercial interests. So that really is talking about the industry and the kind of the tobacco companies and what they do to manipulate the data and to affect policies. So that was really what triggered our case book about called Big Tobacco's Dirty Tricks that we wrote last year or 2 years ago. And an example of what that case book, it wasn't just highlighting the problem, it was also giving recommendations on how to be aware of those things and override them. So one example is the tobacco industry will often create scientific articles, but they won't directly say that it's funded by them, but it will be. So, but they'll have these sort of 2 or 3 links to the author, indirectly maybe funding them, and it'll have some article that'll say, oh, it turns out that cigarettes are actually not as bad as we thought, or whatever. So just sort of that was something to watch out for, and we'd highlight readers' attention of this and sort of give them examples of how to look for this, recognize it, and then dismiss that evidence essentially as fraudulent, basically, because it's not going to be honest if it's going to be tobacco industry funded. So those are the kind of things that the casebook draws attention to, and in that we will aim to increase public knowledge of those kind of tricks, and essentially that improves the implementation of the framework in around the world. So our group doesn't implement policies per se. We don't have any jurisdiction to set out policies. What we really are is a voluntary working group of tobacco control experts from different backgrounds who band together to contribute to public health knowledge. And our intention is that by generating evidence, by synthesizing evidence, by educating individuals and groups and organizations through the likes of webinars, publications, research, presentations, like what we're doing at the moment with the tobacco endgame and vape study, we are aim is to generate an evidence base that can be used by policymakers to make decisions. So, for example, one of the things in the vape study at the moment is looking at what kind of restrictions do this selection of sampled population think might be potentially feasible for e-cigarettes. So, for example, in Ireland at the moment, if you can go into any shop in the country and you can, like a normal newsagent, and you can see the vapes are all right there in front of you, whereas the cigarettes are hidden away behind a cover. So one example is, do you think that banning display of vapes in that way is reasonable? We're also looking in Ireland to increasing the age of smoking from 18 to 21. Should that be done for vapes as well? Or should we ban flavors because they're obviously make them more appealing to young people? So we've got a really good collection of answers from, I think, 35 different countries now, of all those kind of different things. And the idea is that we publish this and we present it and we say, look, this 40% wanted this, 80% wanted this. And then we can use that to influence the people who make the policies, who are not us, but who are the governments and health authorities. And we can say, look, our group has made this information, has synthesized this information for you. Here it is. This is what we recommend. And then hopefully they can take our recommendation forward.